The need for social protection is really at a level where it was there never before, because of the economic stress that people at the bottom of the pyramid have faced. And there's another reason for that also, because COVID has fast-tracked all governments into the digital age. In the digital of today and the future digital of tomorrow, human capital is the single largest contributor to the wealth of the nation. And when you talk about human capital building in a country like ours, where 40% of the children are stunted, the high dropout rate from schools, especially of girls, social protection is a very important lever to push for progress on those indicators as well. Post-COVID, there is this very strong realization that we are sliding backwards on the poverty eradication global targets. So the MDG, the first MDG in poverty eradication, was achieved, I think, a decade ahead of time. And with the corresponding SDG, which is SDG 1, the world is slipping backwards and very fast. So the quantum of, or the number of people who've fallen below the poverty line, or for whom the COVID crisis has been catastrophic, the actual numbers are yet to be determined at a global level, but the estimations are staggering. And there's every reason to believe that COVID will leave us with increasing numbers of poverty all across the world, and the need to augment social protection. Pakistan, I would say, was on a very firm footing when COVID struck, with respect to our readiness with regard to social protection. Because in early 2019, we started the consultations around the Ehsaas Program. March of 2019, Ehsaas was formally announced by the Prime Minister.
मैं सबसे पहले तो डॉक्टर सानिया निश्तर आपको आज ख़ास खराज तहसीन पेश करता हूँ, क्योंकि आपने बड़ी मेहनत से ये डॉक्यूमेंट बनाई है.
Then we took the entire year in 2019 building the digital infrastructure, getting the survey on an accelerated pace, which of course was stalled in 2020 when COVID struck for a year. But we were fairly on a much better footing than many other countries were in March of 2020, when we were asked to do a huge assistance package, which then got to be known as Ehsaas Emergency Cash. And we reached out to 15 million individuals. The World Bank, in its official report, said that we did the fastest deployment. And in terms of the percentage of population covered, we were the third largest, following the United States and Japan, which are countries with which we have no comparison in terms of their resource base, in terms of the strength of their institutional systems, in terms of the liquidity, and so on and so forth. It was the Prime Minister's vision that we want to invest in social protection. He keeps on saying again and again in his public addresses, and to us in private audiences and in cabinet meetings, that my policy is for those at the bottom of the pyramid. He genuinely believes in it. So despite the stresses of COVID, despite the preoccupation, and despite our hands being full of work with regard to the execution of COVID Emergency Cash, Ehsaas Emergency Cash, we completed our survey last month. We nationally upscaled the school stipend program, which is a very important input into human capital building. We deployed our Ehsaas Nashinuma, which is the program to address stunting, completed all goals for pilot deployment, and we made sure that the survey registry that we have today is a shock responsive registry. because we all know that climate change brings, on the annual droughts and floods and all kinds of disasters. And it is absolutely critical for a country like Pakistan, which has a rural agrarian economy with the Indus River as its backbone, to pre-position cash transfers when such environmental disasters are predicted. One day we were discussing the name. So what do we call this new grand poverty alleviation program? And Senator Faisal was at the table. He said, "I think we should call it Ehsaas. It's a very nice name," and that's so. Senator Faisal is to be credited with coining the name. And then, of course, we made a logo. The logo that we made, the Prime Minister did not like at all. He said, "You have to factor in the schematic of, Riyasat-e-Madina, the Gumbad-e-Khizra somewhere in the logo." So we took several iterations of the logo to him, some which were more abstract, others which were more illustrative, and he picked up the abstract one. So he chose the logo, we took the designs to him. As a cardiologist, you see patients and you have a very, for lack of a better expression, a narrow worldview. You think you are God personified because you can zap people into life, and you are the difference between life and death for people in a coronary care unit. And you just think about the patient and treatment and yourself, but you don't have a broader worldview. And there was one particular incident which really changed the course of my career, because the hospital where I was working catered to the rich and the poor and people from all walks of life. And one day there was a hospital circular which said that we should use used disposables for patients who couldn't pay. And if a patient pays, you can open a new set, but if a patient cannot pay, you disinfect the new set and use it for that patient. And I told myself, that's not how I'm going to spend the rest of my life. And by that time, my interest in public health had fairly firmed up, and so I took a 3-month leave to work on my NGO, which I had created for public awareness, a very small organization where I aspired to create public awareness. There was a point when I had stepped out of the hospital and decided not to go back ever again. People would call up my husband to ask if I was in my sane mind, because I said, "Your wife is well trained. She has this enormous potential to earn, and here she is, having left clinical medicine and doing something that they thought had no scope. And says, is she out of her mind?" I recall my colleagues really pushed me and said, "Well, this is the done thing. You come to the hospital in the morning, you do private practice in the evening, you need to have a clinic, and you need to start charging patients, and this is the done thing for well-trained doctors." And I recall just for one day setting up a clinic, just for one day, and the first person coming and paying a fee of 500 rupees. And I saw that, this was about 2 decades ago, and I saw that patient, I prescribed her, and when she was walking out of my office, I just looked, she had opened the blinds, and I looked at her, and I called the person on the reception. I said, "Take these 500 rupees, give them back to her, thank her for coming, and please shut this. I'm never going to do this ever again." And that is, so this is a choice I made. This is a choice I made, and I may be not as affluent as I would have been had I continued to be a cardiologist, but I'm very happy in what I'm doing. The first thing is respect for rules. That is extremely important. One of the key things that the government has to do is to abide by rules, to abide by norms and rules and regulations. And if you have to innovate, you have to innovate within the confines of those rules, or develop rules when you innovate. The other thing is that you have to have certain discipline, execution discipline. When execution of programs comes, first you have to you have to design programs properly, because a lot of times people sow the seeds of failure when the program is being designed. Sometimes it is because of lack of understanding or lack of the will to have the rigorous peer review to improve it. And sometimes I have seen for myself it is mala fide. So you sow the seeds of failure because you want to personally benefit from it, because there's a rent-seeking objective, because there's an outright corruption objective embedded in what you're structuring. So I think the governance, the design, and then is how you execute. So the execution is a totally different ball game. You have to be very, very disciplined. So we have a delivery unit. So every program is broken down into milestones, into 3 monthly milestones, into monthly indicators. And for some programs, there's daily follow-up. I recall once I was having a meeting and we had to execute a cash operation, and we were doing the daily work plan, because as you get closer to execution, you do a daily work plan. And we said, well, this thing is going to take 7 days. And the next day, the finance person brought that thing turned around. I said, well, I've done it. I worked till very late. I've done it. Because they believe that there is a culture of integrity within the organization. If they knew that I was a corrupt person, that I was giving favors to my own, to my relatives, and had my relatives given employment to them, and had my driver's children employed they would never respect me. So you have to set an example. You have to set an example. You have to empower people people with clean hands. And once they feel empowered, and once they see that there's a culture of integrity, they do perform. And the reason why people like me and many others have the ability to have clean hands and is also because we are not pushed by the Prime Minister's office. We never get phone calls to say, isko naukri do, isko theka do, isko transfer karo, isko posting karo. So I think that is a great enabling factor. That has been a great enabling factor for all of us, and I just want to recognize that. I think because the media has such a huge influence on molding public opinion, I think impartiality, being unbiased, being impartial, the quest to be a little more objective in the analysis would really help, because everybody's glued to the television, watching these 10-15 people swing public opinion in one way or the other. It's a huge responsibility. So I think the need for objectivity is very important.